and welcome to Connect MKE. I'm your host, Denise Calloway. The COVID-19 pandemic may be over, but COVID-19 is still with us. In parts of the United States, COVID-19 hospitalizations and positive tests are on the rise, just as a new, highly mutated variant of COVID-19 is beginning to emerge around the world. What does that mean to us here in Milwaukee? How do we continue to protect ourselves from COVID-19? And do we know what's going to happen this winter? Joining us to help us understand all things COVID is Dr. Ben Weston, Milwaukee County Chief Health Policy Advisor. It's good to have you back with us, Dr. Weston.
Well, thank you for having me. I'm glad to be here.
What are we seeing here in Milwaukee County now as it relates to COVID-19?
Yes, we're seeing a bit of a mixed picture. Without a doubt, we're seeing an increase in disease burden. We're at about 15% positivity. That means 15% of tests are turning up positive. Now, that's an increase from about 5% in June. And we've seen a bit of an uptick in hospitalizations as well, from the teens up into the upper 20s. So without a doubt, there's more COVID out there. There's more cases occurring. Now, what we're not seeing quite as much is that severe disease. I did mention an increase in hospitalization. So certainly among certain folks, we're talking mostly folks over 65 years old or those with immunocompromised, certainly they're getting hit harder, as has always been the case. But still, our hospitalizations remain relatively low, and we have not seen a change in our trend of deaths. So severe disease remains fairly low, even as cases rise.
How confident are we in that data? You know, one of the things that was happening during the height of the pandemic is that people really weren't able to get their hands on those test kits that would let them test at home. So many things are not necessarily being reported to the medical community. Do we feel pretty confident that those numbers that we're seeing in terms of hospitalizations are really reflecting the amount of disease that's out there?
So I'll say yes and no. So I do think the trends are accurate. I do think the increase in positivity we're seeing is accurate. I think hospitalization trends are pretty accurate. And most patients who come into the hospital still are tested for COVID. So I think those numbers are good. Now, to the no part, what's not as good are really the number of cases out there. Most people, myself included, if I get sick, I do a home test. I'm not going to a testing site or to a clinic to get my test done. And there's no method to record that publicly. And so most of those home tests aren't getting recorded. So the actual number of cases out there, we don't have a good handle on. But what we do know are the trends, and that tells us that there's an increase in disease burden.
What variant is infecting people now? We understand that there's now a highly mutated variant, B2.86, that's out there now. Are we starting to see any of that here, or are we seeing some of the earlier subvariants that are still impacting people?
Yeah, so we're still seeing this alphabet soup of variants. BA2.86 is the newest. It's, as you mentioned, highly mutated, which is always concerning. Are our vaccines going to work? Is our, previous immunity from infection going to work? Is it going to show up on tests? All these sort of things. Now, up to this point, every single variant we've seen has shown up on tests, has been affected by the vaccine, and has been affected by previous infection. And so that's a pretty good trend that we have right now. And so each time one of these new variants crops up, it is concerning. And we look to it and we see that it's going to be consistent with the past ones. Now, this new one, the reason it's getting more attention is there's just a lot of mutations. There's a lot of changes. And when those mutations happen, it doesn't fit quite as well with the test. And so it may not show up quite as well. It doesn't fit quite as well with the vaccine. It doesn't fit quite as well with the immunity we've developed from being infected before. And so that remains to be seen. But we've seen a pretty good trend of our immunity holding strong from infection, from vaccine, and of our tests continuing to work. So that's the newest variant out there. There certainly are many others. EG5 is another variant that has increased. Now, all these variants are descendants of Omicron. So we talked about Alpha and Delta, and Omicron is kind of the latest generation of COVID. And so there's no reason to think that our vaccines won't still work, that our past infection won't still work. But certainly it's something to keep an eye on.
Is this one of the things that we're just going to have to get used to? First of all, there's nothing that indicates COVID is not going to remain with us. And secondly, we're just going to have to get used to the fact that these variants are going to pop up, and we don't always know what that means until we're in the middle of a state of infection with those.
That's right. We're long past the idea that we may get rid of COVID. I think COVID is here to stay, and we'll continue to see mutations. That's how viruses work. They're replicating constantly, and as they replicate, mistakes happen in that replication. And usually those mistakes do nothing, or they weaken the virus. But every once in a while, one sneaks through, and it's survival of the fittest. That virus does better. It infects better. It spreads better. It transmits better. And so it becomes more predominant. But what is different now are the tools that we have. We're in a very different place than we were 2-3 years ago with COVID. We have antivirals for if you get sick. We have over-the-counter tests that you can get and test at home. We have quite effective vaccines. We have a booster coming out in a few weeks. We're in a very different place than we were before, a much better place than we've been in the past.
How do we begin and make sure, we shouldn't say begin, because we hope people have always been exercising caution now that since COVID's been with us, but how do we continue to protect ourselves against COVID? Is it just some of the same tried and true methods that worked in the past?
Well, there are tried and true methods that we know works. Now, I'll tell you, I think the safest, the easiest, the least invasive in your life way to stay protected is the vaccine and the booster. You get the shot and you get the protection. Now, maybe if you're, about 1 out of 3 people, you get a sore arm. If you're 1 out of 3 people, you feel crummy for the next day. But that's a lot better than getting COVID and feeling crummy for a week, let alone getting hospitalized or getting more severely ill, especially if you're in a higher risk group. And so staying up to date on vaccines and boosters, we're going to have a great chance to do that in a few weeks when a booster is released. That's the safest way to stay protected from COVID. And again, the least invasive way. Now, for folks who are more vulnerable, if you have certain medical conditions, if you have a compromised immune system, if you're in the older population group, you may want to be more cautious. You may want to think about when you're out in crowds, especially when COVID is more prevalent like this. You may want to think about high quality masking. And really, if you're going to mask, we're talking about high quality masking. We're not talking about cloth masks anymore. We're not really even talking about the paper surgical masks anymore. We're talking KN95 or N95 masks. If you're in that population and you decide to mask, those are the ones that are really going to be most effective for you.
Are we expecting, or should we expect, that come this winter, if we see COVID rates rise as they did a little bit last year during the winter months, people should think about the idea of, again, protecting themselves, not just with the vaccine, but maybe looking at masking again during the winter?
Yeah, so we haven't, there's different thoughts here. I don't think we've proven that this is a seasonal virus at this point. I think it really is much more dependent on variants and what's going on in other parts of the world. This is a global virus. This isn't specific to the United States or to our region or our hemisphere or continent. It's all over the place. And so if a new variant crops up in some country across the world, it will come here pretty quickly. So we may see an increase in cases. I assume at some point over the winter, we'll see an increase. We're already seeing an increase going into fall. Certainly in our region, one thing that is specific to our region is as it gets cold, we all go inside. And we are more likely to spread disease to one another inside. So I think as we look to the winter, the best thing to do is to keep your immunity up, get that booster that's coming out in a few weeks. There's going to be a few shots to get. We can get to that. But definitely get that booster that's coming out in a few weeks. We'll have more guidance soon on that as soon as it's released at a national level. And then think about your risk level. And if your risk level is high or your concern is high, certainly using masking, using distancing, using ventilation are going to be critical as well.
Let's talk for a minute about that new vaccine. Do we know what's going to be in it, and how prepared is it to give us protection from some of these variants that we know are out there?
Yeah, so what we know is it's going to be an Omicron-specific vaccine. So that's important. That means it's going to target the most recent strains of the virus. It's going to be much more up to date. than vaccines and boosters that we've seen in the past. So it's going to be important to know. The other thing we know about it is a lot of people out there, myself included, haven't gotten a booster for about a year. So that's a long time with the life cycle of these boosters to not get boosted. So for a lot of us, now some people got an update back in the spring. If you're in certain populations, you decided to go out and do that, and you met the right criteria. But for a lot of us, it's been a while since we've received a bump in our COVID immunity. So I'm certainly looking forward to getting boosted, having that bump, and hopefully not getting COVID throughout the winter months.
Is one thing that we need to be aware of is that in the past there has been a discrepancy in the number of people, and particularly amongst people of color, who have been getting those booster vaccines. What plans are in place, or what can we do to make sure that everyone is getting the information about these vaccines and everyone has the opportunity to be protected?
So I think you said the two most important words there. It's information and it's opportunity. So information is critical. And in Milwaukee County, in partnership with our health departments, in partnership with our health systems, in partnership with you, we're going to reach out. We're going to try to reach all different segments of the community and talk to them about the COVID vaccine, talk to them about the other vaccines, childhood vaccines, the flu vaccine, RSV vaccine. There's a lot of things to talk about out there. Makes for complicated messaging, but it also makes for an important time to do that messaging. So that's one, is getting the information out. And then, of course, the other is opportunity. And really, in Milwaukee County, when we think about opportunities, we think about barriers. And so we want to take down any barriers that are out there. Is it a transportation barrier? Is it a financial barrier? Is it an information barrier? And try to overcome each of those for all our different segments of populations. But we don't do that alone in Milwaukee County. We do that with the health departments. We do that with the health systems. We do that with federally qualified health centers and community organizations, all working together to reach those different populations.
Well, now we know when we roll up our sleeves, we're going to get that COVID booster, we're going to get the flu vaccine, the flu shot, and if we're in a vulnerable population or a population that needs to get it, get that RSV vaccine as well.
That's right. So what I would say is right now, anybody over 60 right now can go out and get the RSV vaccine. And not to complicate things, but there's some evidence the RSV vaccine may interfere with the others if you get them at the same time. So this is a good time. Go out, go to your pharmacy, talk to your healthcare provider, get the RSV vaccine now, and then you'll be ready for COVID, you'll be ready for flu when it comes later in the year.
Great advice as always. Thank you so much, Dr. Weston.
Thank you for having me. Take care.
You too. Coming up, we'll learn more about efforts to reduce violence in Milwaukee. Stay with us.